Hi, my name is Denise Roselle, and this is my head-to-toe assessment for Advanced Health Assessment at Maryville University. This is my husband, Robert Roselle, and he's agreed to be my patient tonight. He has already emptied his bladder. He has a hospital gown on. We got a full set of vital signs, including a height and weight. We've finished the Snellen chart and also the Rosenbaum, measuring distant vision and also near vision, and that is a measurement of optic nerve, which is the cranial nerve number 2. We're going to start the assessment with a visual inspection of the face, the ears, the eyes for symmetry, and also the skull for to see if it's normocephalic. I'm going to gently palpate the skull, feeling for any masses or just any overall abnormalities. Also palpating the hair, feeling for texture and also distribution, and that it's well adhered to the scalp and no hair comes off. I'm also just going to palpate gently the face, feeling for any masses or any abnormalities or tender areas. Okay. I'm going to ask the patient to open and close his mouth. And does that elicit any pain?
No.
Okay, and that's assessing a temporal mandibular joint, and there was no clicking either during the assessment. Right. Now I'm going to check the cranial nerve, facial cranial nerve, number 7. I'm going to ask the patient just to make some different faces. Could you furrow your brow? Okay, could you close your eyes real tight? Open your eyes. Okay, put your teeth together. Good. Smile. Puff out your cheeks. Good, and stick out your tongue. And move it from side to side. Very good. And asking the patient to stick out his tongue from side to side also assesses cranial nerve number 12, which is the hypoglossal. Next, we're going to assess cranial nerve number 5, which is the trigeminal. And we're going to do that by testing the light sensation. Can you close your eyes? Okay, I'm just going to touch your face. I want you to let me know if you can feel me and where you feel me.
Left forehead, under my left eye, left chin, right chin, under my right eye, right forehead.
Good. And would you say that that was sharp or dull?
Dull.
Okay, very good. All right, now we're just going to move on to the eyes. Again, I'm doing a visual assessment of the eyes, looking at the hair distribution and the symmetry with the eyebrows and the eyelashes, making sure that the eyelashes are growing up and out. I'm also going to ask you to look up, and I'm just looking at the conjunctiva and the sclera of the eye. Conjunctiva should be a nice pink, not red, not inflamed, and then also just the overall whiteness of the eye. I'm going to gently also palpate the lacrimal apparatus. Does that cause any pain?
No.
Okay, and there's no discharge. I'm also going to palpate on the frontal sinuses and the maxillary. And does that cause any discomfort?
No.
Okay, good. All right. Now I'm just going to perform some visionary tests. The first is going to check the pupillary response. And I'm going to use my pen light. I'm just going to ask you to look straight ahead. Don't move your eyes or your head. And I'm just going to flash the light in your one eye, and I'm looking for direct versus consensual response of your eyes. Direct and consensual. And direct and consensual. Very good. Next, we're going to do the cover-uncover test. And again, this is also measuring direct versus consensual response. Could you cover your right eye? And I'm looking at the uncovered eye and just seeing how it responds. And now could you please cover your left eye? And again, a direct consensual response. Thank you. Okay. Next, I'm going to check the 6 cardinal fields of gaze. And this test actually assesses cranial nerves number 3, 4, and 6. Okay. Just going to ask you to move your eyes, not your head, and to follow the light. Okay? Any questions?
No.
Okay. Good. And that's a good measurement of ocular movement within the eyes. Okay. And next I'm going to check the red reflex within the eyes using my ophthalmoscope. Okay. You just look straight ahead. And there it is, the red reflex in the left eye. And in the right. Good. Okay. Next, we're going to move on to the ears. Going to check the overall inspection of the ears and the symmetry. And just gently palpate the auricles, feeling for any masses or abnormalities. Okay. I'm going to take my otoscope and I'm just going to look inside of each ear. I'm going to gently pull up on the auricle and back. And I'm assessing the inner ear canal for any redness or swelling or excessive cerumen. Also assessing the tympanic membrane, which should be a pale shiny gray. And there it is. Good. Very good. I'll also be doing that on the right side, pulling gently back on the auricle and assessing the tympanic membrane and also the mucosa within the ear for any redness, swelling, and that looks really good. I'm going to do a couple tests that indicate hearing ability. First is called the whisper test. And if you could please put your finger in one ear, and then I'm just going to let me know what you hear me say, okay? Apple.
Apple.
Banana.
Banana.
Good. Very good. Very good. Next, we're going to use the tuning fork. First, we're going to do the Weber test. The Weber test also helps to measure conduction of sound. I'm going to put it at the top of your forehead. Just let me know where you hear the sound in one ear over the other or both equally.
I hear it equally.
Good. Okay, so that's a good test. Next, we're going to do the Rene test. The Rene is measuring bone conduction versus air conduction. Put it on the back of your mastoid bone, and then when you no longer hear it, let me know. I'm going to put it in the front of your ear, and when you no longer hear that, let me know.
Okay. No longer hear it. No longer hear it.
Good. And bone conduction is less than air conduction. Air conduction should be twice as long as bone conduction. So that was a good test. Okay. Next, we're going to go over to the nose. And I'm just looking at the overall symmetry of the nose and the skin and also the septum for any obvious deviations, which there are not. I'm going to ask you to just put your head back. I'm just going to gently insert the otoscope, and I'm just looking at the inferior and middle turbinates and the overall mucosa of the nose and the septum. And again on this side, the inferior and middle turbinates, the mucosa of the nose and the septum, and that looks good. Okay, I just want to check the patency. Could you occlude one there? Take a deep breath. Good. And do the same on the other. Good. Very good. Okay. Now we're going to move down to the mouth and the pharynx area. Just going to initially examine the outside of the mouth, looking for any obvious ulcerations or sores or redness. Also looking at the outside of the mouth for any fissures, open areas. Okay. Again, could you open your mouth? And I'm just going to start my inspection by looking at the hard palate and the soft palate, the buccal mucosa. I'm looking at the tonsils for any inflammation or pustules, the pharynx, the overall condition of the oropharynx, the uvula, which should be midline. Okay, can you lift your tongue? Okay, the condition of the skin underneath the tongue itself, which should be red and beefy with no swelling or ulcerations, the normal fissures on the tongue. Okay, I'm looking at the teeth for the number of teeth, any broken areas or decay. All right, and there's no mouth odor, and that looks Very good. Okay. Now we're just going to continue our assessment, moving down, looking at the neck, the overall symmetry of the neck, and smoothness of the neck itself. I'm not looking for any jugular venous distension, of which there is none. I'm going to start with a gentle palpation of the trachea. Okay, and if you could please swallow. All right, and I'm palpating the thyroid to feel for any masses or irregularities when he swallowed. I'm also going to check the carotid pulse. And that's nice and strong. Okay, good. Now if I could just ask you, we're going to do some passive and active range of motion. You can move your ear to your right shoulder, and then to the left shoulder, and to pull your head back and forward, and shrug your shoulders. Good. And now resistance against my hands as you shrug your shoulders. Very good, and let it go. Very good. Okay. Next, I'm just going to feel your nodes, starting with the preauricular, postauricular, the occipital, tonsillar, submandibular, submental, anterior cervical, deep cervical chain, posterior cervical, supraclavicular, infraclavicular, and if you can lift your arms up for me, axillary. Okay, very good. And lastly, I'm just going to oscillate with the bell of my stethoscope over the carotids, listening for any bruits, and over the thyroid for any hums. Good. Okay. I'm just going to check the overall condition of the anterior chest, the arms, the shoulders. I'm looking just for symmetry of both. I'm looking at the hands, the nails, the capillary refill. Should be 3 seconds or less, which it is. I'm going to feel for the brachial pulse and the radial. And I would do that bilaterally, but just for the sake of time, we're not going to do that. And then if I could ask you to just turn around, I want to assess your posterior back. Okay. Thank you. Again, we're just looking at the overall configuration, thoracic configuration of the back, the symmetry, the skin. I'm going to just start the gentle palpation of the spine down the vertebrae. And if you could just let me know if I'm causing you pain or discomfort anywhere as I'm moving down. Does it hurt anywhere?
No.
Okay. I'm going to come back up here and I'm going to check for the costovertebral angle. Let me see if I can elicit any response. Does that feel anything?
No.
Okay. If that would have been a positive response, if that would have caused any pain, that could be indicative of polynephritis. Okay. Now I'm just going to percuss the entire back in between the intercostal spaces, systematically from side to side, and also laterally. Listening for resonance, which is the expected sound to be heard. There you go. I'm also going to check for thoracic expansion. I'm going to put my thumbs together and I'm going to ask you to take a deep breath. And you'll see how my thumbs come apart. And again. And I'm positioning my hands right below the 10th rib. Okay. I'm going to come up here. And when you feel my hands on you, please say 99. And I'm checking for any tactile fremitus.
99. 99, 99, 99.
Okay. Next, we're going to check for diaphragmatic excursion. And I'm just going to ask you to bend forward just a little bit. All right. I'm going to ask you to blow out all the air from your lungs. Take a deep breath and then blow out all the air. Good. I'm going to percuss down. Good. I'm going to mark that area. All right, now I want you to take a normal breath. Okay. Now take a deep breath and hold it. Good. All right. And that measures between 3 and 6 centimeters, and that's within the normal range that we would expect to see for a healthy individual for diaphragmatic excursion. Okay, if you could please turn around again. All right, I'm going to pull this down. Take your arms out. All right. Now we're just going to do the anterior chest and heart area. Again, I'm just assessing for overall inspection and symmetry, looking for any obvious pulsations, heaves, and thrills, looking at the respiratory effort, the respirations of a healthy, normal individual, between 18 to 20 breaths a minute, no use of accessory muscles, just a calm, relaxed breathing. I'm going to just start with an overall just feeling of the chest, for any masses or any areas that may elicit any pain or discomfort. Okay, good. All right. Then we're going to assess the precordium, starting at the apex of the heart. And this is where we would also feel for the apical impulse, the left sternal border, and then at the base of the heart. And then again, we would feel for tactile fremitus. Say 99.
99, 99, 99, 99.
Very good. Okay. And then we're going to do an overall palpation of the anterior chest, just as we did on the posterior chest. The intercostal areas. Again, listening for resonance. Anything other than that would be considered abnormal. Okay. And now I'm going to do an auscultation of the anterior chest and also of the heart. Listening for any adventitious breath sounds, such as rales, bronchi, and wheezing. Listen in a systematic way, side to side. Okay. I'm going to listen for the heart, starting at the aortic, pulmonic, Erb's point, tricuspid, and mitral. All right, very good. Okay, if I could ask you just to lay down, please. Turn your arms back in and lay down. Okay, I'm just going to roll this up just over your abdomen. Okay, now we're going to inspect the abdomen. Initially, I just want to look for the overall characteristics of the abdomen. With my pen light, I'm going to inspect the overall contour of the abdomen, looking for any bulges, herniations, pulsations, anything that just appears abnormal. I don't see anything here, so that's good. Then I'm going to start with an auscultation of the abdomen over each, listening to all the quadrants from 2 to 5 minutes as needed to hear a vowel sound. And he has very good vowel sounds, easily audible. Okay. And while we're here, we're going to listen for the abdominal arteries, starting with the aorta, renal, right renal, left renal, left iliac, right iliac, right femoral, and left femoral. Good. Okay. I'm going to do just an overall percussion of the abdomen, just to get an idea of overall tone. Listening for dullness over the organs, and tympany over air-filled areas. Okay, we're going to come over to the left, and we're just going to percuss over the spleen, listening for the dullness over the spleen. Okay. Then I'm just going to come up to the right area here and feel for the border of the liver. I'm going to start by percussing down. Right there. Then up. There. Right there. And right there. And that measures between 6 and 12 centimeters, and that is the expected distance of a healthy liver. Any larger, there might be an indication of cirrhosis, and that would need further follow-through. Okay. Now we're just going to do some light palpation on the abdomen, just feeling for any masses or if it elicits any pain, and then some deeper palpations. Okay, we're going to come over to the left side, and we're going to see if we can palpate the spleen. You take a deep breath and let it out. And a lot of times in a healthy individual, we're not able to palpate the spleen. And then the left kidney, and let it out. Okay, I'm going to come over to the right. See if we can feel the right kidney. Take a deep breath and out. Good. And lastly, the liver. See if we can feel that slip past our fingers. Take a deep breath and out. Good. Very good. If I could ask you to lift your head a couple of inches, I just want to check the abdominal muscles, and that's very good. Okay, you can put your head down. I'm also going to come over a little bit to the left of midline and feel for the aortic pulsations. And that's good. It's right there. And that's what we expect to feel right there to the left of the midline. Finally, I just want to elicit the response of the abdomen to make sure there's no more contracture, going inward, bilaterally, and that is a positive, good response. Sorry. All right, we're done with the abdomen. Now I'm going to work my way down to the lower extremities. You can just lay there. You can scoot down, okay. I'm looking at the overall skin condition of the legs, the color, the hair distribution. I'm going to feel for the temperature, feeling for any swelling, any edema. I'm going to feel for the pulses, the dorsalis, medial, dorsalis pedis, yes, and the popliteal. Dorsalis pedis, posterior, and popliteal. Also checking if you could bend your leg. Checking for muscle strength. Lift your leg. Muscle strength. Good, and that's good muscle strength. Okay, you can put your legs down. All right, if you could sit on the side of the table here. All right, I'm going to check your reflexes. Okay. Again, we would do this bilaterally, but I'm just going to do it on one side for sake of time. Brachial. Radial. Knee. All right, good. And I'm also going to check strengthening. You can resist me up and down. Good. You bend your arms in front of you. Push up against me and towards you. Against me and towards you. Okay, we're going to check some range of motion within your cervical spine. Can you push your head against me to the right shoulder and to the left, to the front, and to the back? All right, good. If you could stand up, please. All right, you look to the door there and a little forward so you can see me. We're going to check your lumbar spine. If you could turn to the right and turn to the left. Okay, and if you could bend backwards. And if you could bend forward, touch your toes. And I'm just looking at the spine for any evidence of scoliosis or kyphosis. And that looks good. All right, you could stand up. Okay, and that concludes my evaluation. And just in review of the 12 cranial nerves, number 1 is the olfactory, and that measures your smelling, and there's no deficits with this patient. Number 2 is optic, and that was measured with the Snellen test. Cranial nerves 3, 4, and 6, they were all measured with the 6 cardinal fields of gaze. Cranial number 5 was the trigeminal, and that was measured when we did the sensory sensations on the face. Cranial nerve number 7 is the facial, and we also did that when we asked the patient to make different muscle movements in his face earlier in the exam. 8 is the acoustic, which is hearing, and that was measured in various ways between the Weber's, the Rhine, the Rene, and the whisper test. 9 and 10 is the glossopharyngeal and the vagal. They're both measured when I asked the patient to stick out his tongue and say ah, or if I would have further elicited the gag reflex. And 12 is the hypoglossal, when I asked the patient to stick out his tongue and move it from side to side. And that concludes this examination. Thank you.